We've been talking a lot about vaccine preventable diseases impacting kids, but there's actually a lot of good vaccines for older adults out there today. That vaccine, maybe it doesn't prevent you from getting flu every time, but maybe when you get the flu, it won't be as bad. And when you're an older adult, especially if you're an older adult with other medical problems, not getting the flu is really, really important. There are vaccines out there, including the high-dose flu vaccine, that actually has a lot more of what we call the antigen, the parts of the flu there that are not infectious but drive that immune response. And so with that higher concentration of that antigen in that flu vaccine, we get better immune responses in older adults. And so we've had one shingles vaccine out there for a number of years, and we've got a second one now, the Shingrix vaccine, which looks to be even better. People may not think about shingles, but many of us, and especially older adults, probably got chickenpox when they were young. And they need to recognize that that virus, the varicella zoster virus, which causes chickenpox, is the same one that causes shingles. And the thing about that is when you get shingles, the most common presentation is that very painful, very itchy sort of lesions and rash, usually on one side of your body. It can be very painful, and sometimes that pain doesn't go away, and it can become quite debilitating. And then lastly, we've been talking a lot about measles recently. And we've become a lot more thoughtful about whether there's opportunities for vaccination or maybe revaccination in adults who are older, particularly over 65. But I think it's really a great idea for any patient to reach out to their primary care provider and say, hey, am I up to date on my vaccines? Because I don't think it's something that we as patients often think about, and particularly as we get older. We really associate, as you mentioned, vaccination with being very young, being a child. But there's great vaccines out there now that prevent some pretty serious infections as older adults. Check your cholesterol, check your cancer screening, check your vaccine status. And those are really good questions for your primary care provider.